Wanted to address a lot of the conversation going on around different types of facelifts. A lot of people have been hearing about a SMAS, SMAS facelift related to some of the publicity it's gotten around Kris Jenner's lift, which is an outstanding outcome. And there's been a lot of buzz over the last really decade about the power and utility of deep plane facelifting. And now that SMAS facelifting, at least publicly, is trending, it's creating some confusion. I do want to say that I don't know for sure exactly what type of lift Kris Jenner got. I don't have that information. I do know it's a good-looking outcome, and it just allows the publicity around it, kind of creates a good talking point. In my opinion, there are a lot of different great ways to do lower face and neck rejuvenation. There are downsides to more minimal lifts or mini lifts or shortcut lifts, thread lifts, things like that. True SMAS lifting, which in itself actually doesn't describe exactly what's being done, because the SMAS can be addressed in multiple different ways. There's sub-SMAS lifting, extended sub-SMAS lifting, high SMAS facelifting, and deep plane facelifting. And so, unfortunately, it gets even more complicated as you dive in. The reality is that there's a lot of SMAS or non-deep plane techniques that can achieve really excellent results, as you can see in some of these cases. And really what it comes down to is, what is a surgeon's particular favorite technique? What is she or he comfortable performing? What's part of their daily repertoire? Have they evolved that technique to be particularly powerful in their hands? For our practice, we began our facelifting career really focusing on deep plane techniques, and that technique has evolved to be really nuanced, in particular in the way we do it to achieve the results that we want to achieve. And we believe that that technique delivers these really high-level, kind of effortless, natural, long-lasting outcomes. But that doesn't mean that there aren't SMAS facelifting techniques that have significant power in terms of their outcomes and positive things about that technique. And this is the way that facelifting has been for forever, where pendulums tend to swing, not always so publicly, which is really due to social media, but amongst surgeons, preferences and what's popular does tend to swing based on thought leaders and consistency of outcomes. I do think that in general, the age of facial rejuvenation just is advancing in a really good and positive direction. I think that there are always going to be examples of bad surgery out there that are still happening right now in any place in the country. And really this is about finding providers that are creating consistently, day in, day out, really high-level outcomes with the technique that they are comfortable with. I will say one more thing. I think that unfortunately, when something trends or becomes popular, a lot of people will adapt their marketing to fit what's popular. So we saw this in deep plane face and neck lifting, where when it became the thing, the surgical technique to have, there were a lot of centers saying, I do deep plane facelifting, where probably that's not the case. Some component of a deep plane lift was being done, but not a true deep plane face and neck lift. Very challenging for a patient or a consumer to really be able to parse out whether the technique is that's being described on the external marketing standpoint is really being done intraoperatively. Again, I think this just comes from patients being vigilant when they're making a decision. Do you know people who've had surgery at this practice? Are you seeing consistently before and afters and feel like, boy, that's a result I would be ecstatic with? Trying to do as much digging and research so that you're comfortable making the choice with your surgeon. So again, I think there's a little bit of misinformation, which makes things confusing from a patient standpoint. But just because there's two different techniques that provide good results doesn't mean that one has to be a winner. I think you have to go with expertise, experience, consistency, and people that aren't just getting pretty good outcomes, but are really getting outcomes that are at that next level.